While the debate goes on over embryonic stem cells, adult stem cells are being used to treat leukemia, and there's word tonight that they may also have been used for the first time to control type 1 diabetes. Here's our CBS News medical correspondent, Dr. John LaPook.
Nurse Nina Sherman is one of more than 1 million Americans with type 1 diabetes. Since elementary school, she's been checking her blood sugar and giving herself insulin several times a day to control the disease.
Have you thought about a day when you wouldn't have to take insulin?
I don't think about it that often, to tell you the truth. It's hard to imagine at this point in my life. I can't remember not taking insulin.
But a new experimental kind of immune therapy using adult stem cells, and described today in the Journal of the American Medical Association, might someday enable diabetics like Nina to stop taking medication altogether.
After this treatment, people have been completely drug-free, no medications whatsoever, no insulin, no other medications for their diabetes.
Type 1 diabetics have a faulty immune system that mistakenly destroys insulin-producing cells in the pancreas. The result? High blood sugar.
Poorly controlled diabetes with very high blood sugars over decades can lead to blindness, to amputation, to heart attack, to stroke, and to kidney failure needing dialysis.
In the new treatment tested on only 15 patients, adult stem cells were removed from the blood and stored. The patients then underwent a gentle form of chemotherapy to break down the old immune system. The stem cells were then transfused back into the bloodstream with the hope of forming a new and improved immune system that wouldn't attack the pancreas.
The stem cells in the body do what they normally do. That is, they regenerate the immune system.
After the treatment, 13 of the 15 patients were able to stop taking insulin, but they were only followed an average of 1.5 years. Experts are cautiously optimistic.
This is a preliminary set of findings that offer some hope, but this therapy is not ready for prime time.
For now, the therapy does not apply to the nearly 20 million Americans with type 2 diabetes. But people like Nina are hopeful they'll someday be free of a lifetime of pinpricks and injections. Dr. John LaPook, CBS News, New York.